Corporation's third Wednesday Parent Resource Chat. My name is Bettina Campbell. I am the Social Services Coordinator, and I'm also a Medicaid CHIP Assister for the Oak Hill Regional Community Development Corporation, which is the center, which is the parent corporation of Healthy Kids Mississippi. I will be your moderator today. We also have with us this morning Lottie Minor, who serves as the project director for Oak Hill Regional Community Development Center, and Mr. Thomas Duke Robinson, our technology metrics director. And he's assisting us today with technology, and all I can say is thank God for him. In addition, we want to recognize our board chair, Jennifer Garrett, our executive director, Dr. Michael O. Minor. And today I want to give a special shout out and thanks to three of our navigators who helped to put this wonderful program together for you. Sister Pat Boga, Sister Mary Fenner, and Sister Mary Stickler. Remember, we are restreaming today's webinar on our Oak Hill Regional Community Development Center and our Healthy Kids Mississippi Facebook. Feel free to share your social work pages. Now, today we have two amazing guests with us. Ms. Jillian Harper Peavy, who is the program director of Healthy Kids and Moms and Healthy Babies of Mississippi, and Ms. Sheila Davis, who is the program director for Family Resources Center in Tupelo, Mississippi. And once again, I want to encourage you to share today's webinar in your social media network. Feel free to post the questions or comments in the Zoom chat and also in your social media comments. And we will also do our best to respond to each question. And later on, maybe we may even have an opportunity for some of you to open up and ask your questions live. So once again, I wanted to tell you that we have Mrs. Jillian Harper Peavy here with us today. She is a licensed master's level social worker with 10 years experience in community organization, management, program development, and over 8 years experience in providing case management and therapy to diverse client populations. Jillian's career highlights includes creating an integrated academic and health approach to counseling and at-risk college students, developing a curriculum which provides interactive health education modules to prepare pregnant and parenting teams for motherhood in the state of Mississippi, and serving on the Mississippi COVID task force within her church jurisdiction. Does a lot, y'all. She has a bachelor's degree in broadcast. She has a bachelor's degree in broadcast journalism and a master's in social work. Jillian currently works at the Mississippi State Department of Health as the program director of Healthy Kids, Healthy Moms, and Healthy Babies of Mississippi. This program provides services and support to high-risk pregnant women and their infants, and this includes expecting and parenting teens and mothers and infants exposed to substance use. Her motto is they are able to empower themselves. And I'm just going to say before she starts, looking at this young lady, it's just hard to believe that she's old enough to have all of this experience. So welcome, Ms. Jillian Peavy, Harvey Peavy. We're so glad to have you here.
Glad to be here. Are you ready for me to get started?
Yes, I am.
All right.
It's yours.
Well, hello, everyone, and thank you all for allowing me to participate in the third Wednesday Parent Resources Chat. And I am a little nervous in regards to, I didn't know we were going to be on Facebook Live, but I am excited to be able to be here today and kind of talk about our program and why it is important. And I'm hoping I'm able to share. All right. Am I able to share my screen? All right.
Yes, ma'am.
Okay. Just a second. Internet technology. delay. Is everybody able to see my screen? Should be Healthy Moms, Healthy Babies, and Maternal and Infant Support Program. All right, so just a little bit about background of why we were formed. If you aren't aware, Mississippi has the highest infant mortality rate in the United States, and it's been there for quite a while, for several years. Our parent program, which was premised, the Perinatal High Risk Management Infant Services System, was created over 30 years ago. And it was started out with a partnership with Medicaid, UMC, and the Mississippi State Department of Health. But it was actually to help in reducing infant mortality rate in the state of Mississippi. And so we're still lagging behind in regards of infant mortality in our state. As well as, if you all have seen recently, especially during the pandemic, of the talk of maternal mortality or morbidity, especially in the African-American community, that we're seeing disparities in regards to our moms losing their lives over some things that may have been preventable if they received the care that they needed. So let's talk a little bit about Healthy Moms, Healthy Babies. So the vision of Healthy Moms, Healthy Babies, a healthy Mississippi, transforming generations, one mother, one baby, one family at a time. And so we have this vision because of the fact that if we can make a connection with mom while she's still pregnant, we have the opportunity to change the trajectory of a baby's or a family's life in regards to making sure that she gets the right prenatal care, that she receives the right care in regards to if she's in need of housing, food, clothes, a job, or anything like that that can help in regards to making sure her family has what she needs. And so also looking at baby, we're talking about development and making sure that baby is well aware emotionally, mentally, and physically able or have the tools that he or she needs in regards to getting prepared for preschool as well as grade school and moving on. Our mission, Healthy Moms, Healthy Babies of Mississippi, is a maternal and infant support program working with families and communities to help ensure that all Mississippi moms and babies have safe birthing experiences and healthy and infant development. So a little bit more about our program. We provide a multidisciplinary support team to assist moms and babies in all 82 counties of the state of Mississippi who have identified health risks. So that could be preeclampsia, that could be gestational diabetes or diabetes in general. It could be homelessness. It could be mental health issues, substance use. There are a range of risks that a family may have to where they may qualify for the program. In regards to infants, maybe low birth weight. It may be that they were a preterm birth. They have a genetic disorder, or a mom or family may be in need of something. So some things that we help with at Healthy Moms, Healthy Babies is finding a medical home for mom and her baby, identifying family and community supports, referral for services such as Medicaid, SNAP, and WIC. We also want to make sure that majority of our families are Medicaid recipients. We want to make sure that all our families do have adequate prenatal care or adequate family care, pediatric care. So we want to make sure they do have an insurance source, and if they don't, we'll still provide those services for them, or make sure that they have the resources they need to get the insurance. Referrals for family planning, mental health, transportation, housing, medical services, child care, employment services, and breastfeeding assistance. We also provide postpartum home visits. And so these home visits is when mom and baby are discharged from the hospital, they get ready to go home. And so we'll call and say we want to come by, check on mom and baby. And so our nurses are checking blood pressure, making sure that mom is doing okay after she's had that delivery, talking about warning signs, post-birth warning signs, but also checking on baby. And we're talking about safe sleep and making sure that baby has formula or needs breastfeeding assistance or what have you. We're checking on our families to make sure that that they're healthy and they're safe and they have what they need. We provide health education such as preparing for the hospital, urgent maternal warning signs, depression, anxiety, caring for a baby, infant safety, healthy infant development. And we also provide nutritional information. Funding for our program. Healthy Moms, Healthy Babies provides premise services. And so I kind of talk about that long name that is tied to Medicaid, is a provider of Medicaid services. So Medicaid beneficiaries are eligible to participate in the Healthy Moms, Healthy Babies multidisciplinary support program. And so we have nurses, nutritionists, and social workers that are part of our program. And so when a provider identifies one or more health concerns or barriers to care on a screening assessment. So usually we receive our referrals from our doctors or our nurses in regards to, we've identified some health risks or some concerns in regards to the social determinants of health. And so we want to make sure that our families get the care that they need. We also receive referrals from community partners such as Healthy Kids or OKIO. It could be from a church community. It could be from a nonprofit organization. It could be a self-referral. So we will take in all those referrals if there is a mom or baby in need of services. All right, looking at our, let me go back. Looking at our program goals. So the main purpose of our program is to decrease preterm birth, improve maternal health, decrease infant mortality, and support infant physical and mental development. And so all these goals are again to help reduce maternal and infant mortality and morbidity in the state of Mississippi, and hoping to have healthier moms and babies. We also work with our expectant parents and teens. We provide care coordination and case management support for expectant and parenting teens 19 and younger. At one point, Mississippi had the highest teen rate. Right now, we may be number 2 or number 3 in the United States. Our numbers have gone down, even though they're high. They've gone down a little bit within the recent years. We also help to increase expectant and parenting teens' access to youth-friendly, high-quality medical, social, educational, and other services needed to be physically and emotionally healthy. And we provide or link expectant and parenting teens to services, again, to improve educational, health, and social outcomes. And so some of the main things that we work with our teens on, of course, we want to make sure that we try our best that they won't have a secondary pregnancy within the next 2 years or while they're in school. So we are talking about family planning with that, and also encouraging them to stay in school. So of course, they had a baby, but it's not the end of the world. That does not mean that they have to quit school or what have you. It doesn't mean an adjustment with their lives, but they can still continue on with getting their education and moving forward, making sure that their family is healthy and safe. We have a program on the coast that is what we call Overdose to Action. And so we assist expectant and parenting families affected by opioid use disorder. And so they provide support and care coordination services to enhance self-sufficiency of participants and to ensure timely access to inpatient and outpatient counseling and or use of medication-assisted treatment and other resources. So these are for women using or have used substances during pregnancy and postpartum. Infants may be enrolled between newborn to 6 months that have been affected by neonatal abstinence syndrome. We do have a few value statements. And so this is what we believe as a program In regards to services, we believe communities need safe, supportive, and nurturing environments for moms and babies. We believe moms deserve access to high quality, culturally competent, and coordinated healthcare services before, during, and after pregnancy. We believe a patient-centered care plan is one of the best tools to reduce risk for moms and babies during childbirth. We believe in supporting, honoring, respecting the voice and experiences of all mothers and their families. We believe early childhood success begins in the womb, and we believe culturally competent and confident healthcare providers can transform from birthing experience for a family. All right, so for more information about our program or information about referring, you can contact me, Jillian Harper Peavy, at the Mississippi State Department of Health. So I've left my 2 numbers. You can reach us at 601-576-7113 or 601-576-8158. And my email address is also on there as well. Thank you all for listening.
Thank you, Jillian, for sharing this awesome information about the services that the state of Mississippi has for our moms and their families. We're going to hold questions until after Mrs. Davis does her presentation, and then we will open up questions for everyone. So just a little bit about Mrs. Davis. She's a program director for the Family Resource Center that is located in Tupelo, Mississippi. She attended Mississippi Valley State University, where she received her Bachelor's of Science degree in criminal justice. She furthered her education from the American Intercontinental University, where she earned a master's degree in education. And she didn't stop there. She went further and she got a master's degree in social work. She's also a certified family life educator, and she's certified national trainer for trainers for active parenting, cooperative and divorce, and 24/7 dads. One thing we can say about our presenters today, they are certainly academically qualified as well as professionally qualified to bring you this information. Ms. Davis.
Good morning. It is an honor to be here today and to be able to bring you some information about the Family Resource Center of North Mississippi. And I apologize, I don't have a PowerPoint, but I do have a lot of information to give you. I'm just, like I said, I'm so elated and so excited about being here. I just kind of put my head together trying to start. Ms. Julian did such an awesome job of some services, and I definitely need to be in contact with you. First, I'm going to say about the Family Resource Center. We've been existing since 1994, so we've been here for a very, very long time. We are a nonprofit agency in the north part of Mississippi, and we seek families and clients every day. And we are really excited about some of the services that we are able to offer. And I will first talk about our one of our programs is our Comprehensive Community Collaborative, it's a long name, demonstration model to strengthen and preserving high-risk families. And that is a funding that we received to the U.S. Department of Health and Human Services Administration of the Children and the Bureau of Community Collaboration to strengthen and preserving families. And with that program, we only offer services for this particular grant I'm talking about right now for Lee County. It's a demonstration model, identifying the at-risk families prior to involvement with the child welfare system, and a continuance to care, prevention and intervention. And we're looking also at narrowing the gap of the disparities within our racial equity. We have a racial equity funding as well from them, looking at the disparities through our families. And one of the ways that we do is by engaging key stakeholders through collaboration, creating partners with organizations, by promoting cultural and equity, and creating a healthy dialogue with moms and about real issues. We have given them a platform to be able to voice their experiences or their concerns within the community. We have a mom empowerment group that is held every fourth Wednesday of the month, and we'll allow ladies and moms to come in. We do educational training. We also help out with some of their needs. So this gives them a voice in the community to be able to share their concerns or their plight that they may be having with their families. And so we're really excited about that. Another program that we offer here at the Family Resource Center is our active parenting. And our active parenting, we have been doing for years, many years. It's our parenting classes we do via Zoom. And now we had just started this week, Wednesday, back in person classes since COVID. And with those classes, we're helping our families to develop empathy, to also facilitate child bonding and attachment, expectation about growth and developments, looking at the child growth and development according to CDC guidelines, also fostering a healthy brain development with our parents, and also looking at the self-worth and trust and security, because a lot of families that come in, they are dealing with a lot of these issues of trust and insecurities. We definitely talk about this one, promoting dignity of children, making sure that we are keeping our children safe in the state of Mississippi. We do healthy relationship classes where we are working with families to help them to learn how to engage into mutual respect, trust, open communication, and listening skills. Healthy, what is healthy and unhealthy in the relationship, looking at some of the domestic violence issues that may be ongoing in the home. All the services that we offer here at the Family Resource Center are free of charge, no charge to the families. We have a co-parenting class that is held weekly. The co-parenting classes help the parents learn how to co-parent. It also helped them to understand the importance of negotiation. It also helped them to important to know that they will be in their child life forever. They are the only parents that these children will have. And so learning how to co-parent effectively through communication is vital. We offer audition and recovery classes. All our classes that we offer are 10-week long classes that we offer. And like I said, again, our classes don't cost you anything to come to our classes. We also have the healthy relationship, the parenting. We do fatherhood only as needed. If they have some issues with fathering, helping our fathers to engage. We offer supervised visitation in the office where you can utilize our child playroom with CPS often used to do their visitation with. And some of the other programs that we have through the CCDM, which is that community collaborative demonstration model that we have, we offer case management with that. And that is a grant that we are working through evaluations. And it's a very promising grant. We've really been excited about the work that we're doing with this grant because we're seeing a lot of lives change with this grant. Now, all our services that we offer within a radius. We don't have any counties that we don't serve except for the demonstration model. It's kind of only for Lee County, but all the other counties or anyone can come to our classes or participate within the needs of the services that we offer here. We have a bed program. So if you have a children in the home that are sleeping multiple to a bed, or a child that may be sleeping in an inadequate space, we have a beds program starting at age 2. Excuse me. We have a bare needs diaper bank, which I'm very proud of, that we have diapers in. we have people getting diapers from everywhere. And we just recently partnered with Baby to Baby, and we are expecting about 20,000 diapers. And I think that will serve up to 300 families in the area. So like I say, in the north part of Mississippi, that we can give diapers and wipes and other items that families may need. We have a small clothes closet for our children, which is called a kangaroo closet. We do car seat safety checks, and also we do car seat based on the recommendations for children age and weight. All of my staff here are certified car seat tech, including myself. We, like I said again, online classes, and those services that we have are really, really important. Through our other programs that we have, we have 3 tobacco grants. Well, we are definitely working with our moms on smoking and vaping, especially during pregnancy. We bring that out through the CCDM grant. We are funded. We was able to get cribettes for our families that are in Lee County. We had a lot of moms that did not have cribs or a safe place for their babies to sleep. So we also do the safe sleep training, education with our families. We are able to provide the cribettes to moms who are of color. We also help our families to sign in of SNAPs, because a lot of times they come in, they don't have SNAPs or Medicaid. So we make sure that we get our families connected to whatever resources to help them to navigate the services within the community. The case managers and the outreach workers do a very good job in pulling in partners, not only from just Lee County area, but all over, not only in the state, but out of the state. We have connections, and our plight is that with maternal health is very important. We stress that, especially with the moms that come in that are expecting, and making sure they get to the doctor's appointment, signing up for WIC, making sure they check with the health department, and also making sure that the children are in car seats and riding safe in Mississippi. This summer we had a summer camp, which was for our racial equity. It was Camp Calico, that we also, not only do we help our moms, but we also help with tutorial needs if their children have tutorial needs, or if the mom have a need to go back to school. Again, we help them to navigate those services within the community. One of the things, I've been here over 20 years, and one of the things that I see with our families is that if you are able to direct them in the right direction and apply them with the right tools and for their tool belt, our families can make a difference for themselves. And I've seen that time and time again. And like I say, sometimes it gets given them the right tools, equipping them with the right tools for they could be able to utilize the services within the community. And we also have the CAC, which is our Children Advocacy Center, where we work with children alleged sexually abused. And those are some of the services. I probably missed something, I'm quite sure. But those are the services that we offer for our mothers in our communities. And we are so excited about the work that we are doing, and we welcome you to come. We are located at 507 South Church Street in Tupelo, Mississippi. Our number is 662-844-0013. And it's been a pleasure to be here today. And I'm sorry about my voice been a little raspy. I'm dealing with some illness here, but it's just a blessing to be here today to be able to share this information with the community. Thank you.
It's a blessing for us, for you to be here also. We have definitely had some wonderful, wonderful information and resources provided to us today by both ladies. And I am so excited. And I'm going to tell you right here that you two will become our new best friends, because we are working diligently to ensure not only that families throughout the state of Mississippi have access to insurance, but to follow up with other needs that they have, to try to make the connections so that they can live a healthy, well life. And so again, welcome and thank you so much. And I'm so glad that our team was diligent in searching out and finding you so that you could be here today to share this wonderful, wonderful information with us. So now we are going to get ready to open up for questions. So if you have any questions, please, when I let you know to open up the mic and ask your questions. But before we go there, there's a change. We have Miss Teresa Zayers on the phone, who is our wonderful partner. And so we're going to open up her mic and let her make some comments.
Good afternoon, everybody. And for you, it's still good morning. I'm sorry. I'm in a different time zone. Well, thank you so much for allowing me to share some remarks. First, maternal and child health is very important for HHS and CMS. As a matter of fact, we're having another meeting next week at the regional level to talk about it. And it has been very informative for me to get the information today from these two programs. So if you want me to provide some feedback, specific feedback to leadership, I encourage you to send it to me. I'm going to put my my email in the chat because I like to share real stories when we're having these conversations, not only data. Okay, so that's my email. So you're more than welcome to send me any testimonial, anything that you want to highlight. If you want me to send me a whole document that you have, you can. I will love the presentation that was shared today. Because it was staggering for me to know that Mississippi is the one that is, and it's awful to have this position in the country with the highest infant mortality in the nation. So that type of information, that type of data, plus the story behind it, I think it can be very powerful, and I would like to share it in that meeting that we're having here on the 24th with HHS agency. It's not only with CMS, it's also the regional director and the Office of the Assistant Health Administrator.
Wonderful. Thank you.
No, thank you. That's why I always join these calls. I always learn something new.
Well, we're certainly glad to always have you with us, and we're going to try our best to make sure that families in the state of Mississippi get information that they need, again, to help them. Because as Mrs. Davis said, they're learning that if they can know about the resources and have access to the resources, they can help themselves. And that's what we want them to be able to do, to be self-sufficient, to be able to help their families to thrive and to live healthy, wholesome lives. So again, we're going to now go back to questions. Do we have any questions on social media?
I'm checking now, and I've allowed anyone who would like to speak the opportunity to open their mic and talk if they have a question that way as well.
Wonderful, thank you. If we don't have any questions, is there someone that has a question here on Zoom?
Sister Bettina, I have a question.
Okay.
Sister Bettina?
Yes.
My question was about the seatbelt use, because I've been working with a family that has 5 children, and I need someone to share with me what are the requirements for seatbelt use, age, weight, or whatever. What are the government requirements for use of seatbelts?
Mrs. Davis, would you like to answer that question?
Yes, ma'am. What you can do, you can give me a call afterwards, and I can get the ages and the sizes of the children. And then we had a family come in the other day that had a car that had 6 in, and they was not riding safe. So I know it's hard to get a lot of those car seats in there because you have the convertible and the high back booster and the low booster. So it depends on the ages of the children who needs a car seat or who don't need a car seat. We definitely don't want children riding in the front seat. So if you can just give me a call at the office, and I'll be glad to take a look. Even if you have that family come, you can share with a video and we can look in the car and see what we can do to give you precise information on how that child can ride safe. My number is 662-844-0013, and you can we can Zoom a call. However, if that parent don't mind us looking at the car and the car seats, so we can see what we're working with.
Okay, thank you.
Mhm.
Wonderful. Are
I
there any
have
other?
a question.
All right,
This is
Ms.
Ms.
Vogel.
Olga. Okay, and this is directed to Ms. Davis or Ms. PV. Is there a limit to services that you provide to one individual? You know, you may have someone that comes to you one time for several services, and then maybe a couple of months later, they need something else. Is there a limit?
I don't have a limit, and I'm gonna tell you why I don't have a limit. One of the things is that we do try to make sure that we're educating our parents and teaching our parents to be self-sufficient. A lot of times we are the only support families have. We try to gradually help them to slowly maybe wean from us, but I would never. I have some clients, I've been working 20 years. I still have some clients that I had when I came here that still check in with me periodically to say, hey, I'm doing this. Is it okay? Or is that okay to do this? Or I'm doing okay. So no, there's no limitation. How many times they can come get a car seat. If they got 5 kids and need 5 car seats, they can get 5 car seats. There is no limit. Now, due to funding, on funding issues for us, like, you know, helping with funding, you know, that's very limited. But we help them to navigate, again, the resources in the community to try to help them to reach out to those agencies. Now, sometimes other agencies do have limit. They can help them one time a year or once every so many, you know, times that they can help them. And we help them to understand that. So we do financial planning with them. And I hate to say budgeting, because when you say budgeting, you try to control my money. But we try to help them to see where they can save, and they can move their money around to make those adjustments to make sure that they are able to be sufficient for their families. And also, if it's meaning to get a better job, you know, what do they need to do in order to get a better job to pay more money, and some things that they can live without, because, you know, a lot of things we do that we don't have to do, that we can live without. So we just have them to have that conversation. It really is their idea, but we just listen to help navigate that conversation in the direction that it needs to go.
And just for healthy moms, healthy babies, and I don't think I mentioned it on the PowerPoint, but we work with our moms during their pregnancy and postpartum as well, and our infants up to 1 year of age. So if there is a family who's graduated from the program and they're still in need of resources, they can definitely call or come by in regards to our staff being able to help them and connect them. And like Ms. Davis said, we do have, you know, our frequent families who just love our services or love certain staff members that they do come back, and we try to help them out as possible. Most importantly, we want to empower them, but also get them connected to resources such as the Family Resource Center and those in the community, so that they'll know where everything is, and you know, just because we don't provide everything. Family Resource Center got it all, but we don't. We like to partner with others who have those services, and so that our families can get it.
Yes. And that was one of my questions as well. Do you partner with other agencies?
Oh, definitely. We can't, we're not an island, so we can't function by, it's called collaboration. So we definitely work with any agency We have a lot of partners, a lot of stakeholders in the community, and I guess I'm looking on the website now. I got adding 3 more through the chat. So I'll be reaching out to you guys to become one of our partners as well.
Well, we welcome that reach out.
I'm calling you today.
And you said you're providing a service that I really like. Seems like the weave through all of your services is this idea and this opportunity to help people learn how to make wise decisions.
Yes,
so good decision-making skills, because we all know that there's a consequence for every decision. Mm-hmm. And so when we help them to learn to make good decisions, hopefully that reduces the amount of times that they will need assistance, because now they're learning how to navigate their own way through life. And that's awesome. And that's what we all want. Are there any more comments or questions? No, if there are no more comments or questions, we don't have any more comments or questions on social media?
No, ma'am, there's no comments on social media.
Okay, well, if we don't, then I just want to take an opportunity to kind of remind you of some things and inform you about others.
So Sister Campbell.
Yes.
I'm sorry, can Ms. Davis place her information in the chat box so I can know how to contact her?
It's there.
It's in there. It's in there. I'll put it back in there again. My number.
Wonderful. Thank you.
You're welcome.
All right. So let me give you some upcoming dates. On Monday, August the 29th at 6 p.m. We ask that you join the Ask Mary and Pat Zoom webinar. And you can know that these ladies have some wonderful information to share, because like I said, they're the ones that helped put together this awesome webinar that we're having today. Also on Saturday, August 20th, is Southern HIV/AIDS Day. The Southern AIDS Coalition launched this day to bring awareness to the continuing and disproportionate impact that HIV is having in the South. So let me encourage you that if you have not been tested and you do not know what your status is, then now is a good time to think about getting that test done, finding out where you can go to get the test done. Also, and I know you can start at the health department, and if there are any community sites where they're testing, they should be able to let you know that also. And finally, our third Wednesday resource chat will be September the 15th. And during that time, we will continue to provide you information about other local and statewide community resources that are available to help families in the state of Mississippi. You may learn more about us at www.oakhillregionalcdc.com. And you may learn more at Oak Hill Regional CDC and Healthy Kids Mississippi. healthykidsms.org. And once again, we want to acknowledge our board chair, Jennifer Grant, and Jennifer Garrett. Oh, Jennifer, I'm so sorry. Jennifer Garrett, and our executive director, Dr. Michael O'Miner. And this has been a production of the Oak Hill Regional Community Development Corporation, belonging, building, and bridging in the Mid-South region and across the state of Mississippi. So we're going to sign off Zoom. Sign off our social media, and we ask that those are on Zoom just stay with us for an additional few minutes for debriefing. Thank you so much. Have a blessed day, everyone.